Hi, good evening. I'm Dr. Philip McMillan. Today I've just been reflective and asking myself a question. Why are people so sick? And I'm asking this clinically, and I'm talking about what is relevant in terms of the some of the UK statistics here, the sickness levels that are rising, and I'll come back to that in a moment. But yes, it is a real question that is disturbing me because there seems to be an inertia, a lack of inertia, a lack of movement towards getting answers similar to what we have seen in excess deaths. So, in this short video, I'm going to just share with you some thoughts about what I'm thinking about and critically why I think it's important that this is addressed. Now, before I start, I just want to remind you we're just 2 days out for those people who want to be involved in advanced COVID 360 virus and variants. This is a closed session. So this is for people who really want to understand, from my research point of view, why I think there are certain characteristics about this virus and the variants that are relevant to the way how the disease presents. So the link is in the description. Certainly click on it. We've just got about 2 days left. Additionally, for those people who are interested in Disease X, this is a book that I'm collaborating with Lumentia Publications. And we are putting together what we think could be a forward plan as to what you do. And additionally, in it, I recently interviewed Geert. I've got his video here. And guess what? If you register, I've collated all of about 7 videos since 2021 that you can look at as well. This is not a commitment to anything. It's just a subscription. You need your email address, and you can join us in this journey if you want to learn more about what we are looking at. So, getting back to my musing and my reflection, why are people so sick? And as I look at comments, because I do look at YouTube comments when I have time, it is so significant the amount of people who are talking about friends and relatives who are sick. And, people have cancer, people have heart disease, but it's way beyond that because younger people are getting sick. Now, here's an important differentiation for people who are older with comorbidities. When they get sick, oftentimes they can die, and that contributes to excess deaths. But younger people who are more resilient in terms of their health, when they have problems, they get sick, and often they don't die. And so they don't always contribute significantly to excess deaths, but it becomes relevant because excess death is mortality. If there is something causing increased mortality in younger people, it will cause increased morbidity. That means they get sick. Now, therefore, we have to think carefully about what really is going on. So I've got this information here. This is from a Statista, and it's the link is in the description. And they were looking at the number of economically inactive people due to long-term sickness in the United Kingdom. So this is from May 1993 to January 2024. This is significant because you can see down here, and I'll go closer. This is 1993. It peaks in about 98, then it gradually comes down. And this is in 2020, where it starts to go up around the pandemic, and it continues to rise higher than it has been in the past almost, 30 years. So this is very significant. Now, think about something. When somebody who is economically active goes on long term sick. We're not talking about they're sick for a couple of days. We're talking about long term illness where they are struggling to get back into the workforce. Either they're on long term sick from their employment or they are sick and they can't get back into employment. There are repercussions for that financially. And some people may say, okay, people are taking advantage of the system, their benefits, and so on. But when you look at the characteristics of the people, very often these are very significantly economically active people, meaning that they were earning high salaries. They don't want to go on benefits because the difference is huge. So when you see somebody who is sick, who has a good job, significant pay, you know they are sick. And so that's one group. So they are sick enough to not be working. But then there's a whole bunch of people who are sick but are struggling with work. That is likely to be massive. So the question is, what really is going on? So I want to take a closer look at the numbers. And it's, as I said, this is a reflection rather than an answer, because part of the problem is that similar to excess deaths, let me phrase this in a way that makes sense. Similar to excess deaths, there is an elephant in the room, and the powers that be don't want to acknowledge the elephant. And so, therefore, in order to not acknowledge the elephant, they ignore what the elephant looks like. Now, the elephant in the room knocking over chairs, there are chairs knocked over in the room, but it doesn't mean that the elephant was the cause of the chairs knocking over. It can be a reasonable assumption because there's a big elephant in the room and there are chairs around. So if he moves, he's likely to knock over the chairs. However, investigation does not specify the cause, so you would need to observe the room. Look carefully. Is it that the elephant is moving? Suppose it's not a real elephant and it's just standing there and it did knock over the chairs, then it was children running through knocking over the chairs. But if you don't investigate, your assumption will always be the elephant until proven otherwise. And so this is for people who are afraid of looking at the elephant. So let's get back to the data. So now when we look at this here, and this time I'll take you through it. This is here in number of people by the thousands, okay? And this is going up from 1800, 2220, 2000, over 200,000. This is over oh no, this is in thousands, 2.4 million actually, come to think of it. And you can see the numbers going up to here 3,000 per thousand, which would therefore be 3 million. And so this is the time, this is the number. This is across the bottom here is the time. So this is 93 going all the way here to May 2023. They have actually looked at it all the way until January 2024. And you can see that it gives you the number per year. You can see 2.369 in 1998. It then comes down. And then at its lowest point here before 1993, this is in October 2016, it's 1990,000 or 1.9 million. And then you have here, this is in May 2019. It's still a little bit low, but it's not the lowest point. And then it starts to rise a bit in December 19, and then it shoots up 2020, by November 2020. This is the first wave of the pandemic. Then it stabilizes a bit here. And then you can see by February, April, it starts to rise again in 2021. And it rises again all the way up to December 21. And then you have Omicron coming along, and then you see another surge up here to August 2022. And then you see the peak here in November 2023. So that's the sequence, okay? So let's look at it objectively again. As I said, here was our start point with the pandemic. And of course, people get sick. Some people, certainly working age people, died, so they got sick as well. And they would have had long term health issues if they were on intensive care. But we know it was less than 1% of the working age population that would have been affected by that. Many of the people who got sick and very sick oftentimes were older people who may not have been working. But you expect a contribution. And you can see it hits here, stabilizes. And then around here, now this is where we had the elephant starting. And you have to acknowledge that. Now, it may be completely coincidental, and you also had the Delta. So the Delta variant would surge again, and the elephant, if possible, if you want to think about that. And again, you have a slow at the point of Omicron. And then you have this massive surge again, all the way up. Now, Omicron was not really getting people in hospital. And so I'm struggling to understand that Omicron could do this on its own. And if it was purely Omicron, we would find that places that were low vaccinated should have similar trends. Now, we don't have any clear evidence of that, so I can't say it's absolutely impossible. But it doesn't look as though places like Papua New Guinea or Meghalaya in India, or looking at parts of Africa, they seem to be largely okay. They are not suffering from this kind of illness pattern that we're seeing across the first world, because the UK is reflective of many other countries. So, our question is, could it be related to the elephant in the room? Absolutely, it could be. We can't say that it is, but it certainly could be. And then the question would be, well, if it could be, and we don't know categorically the cause, why in the world would you not investigate it? I mean, it's flabbergasting. It's all around us. People are sick. We're seeing it in hospitals. GPs are seeing it in general practice. People are seeing it with people off at work, their friends, their family. This is like the biggest open secret. But yet everybody is going around just thinking, well, why? Now some people assume, put it directly on the elephant. Again, I say we just need to investigate it. Because if you don't investigate it, you have no opportunity to mitigate it. What is it? Could it be autoimmunity? That is certainly a big possibility, as I expected would happen once there are interactions with spike protein. And any source of spike protein, based on my research, would be a potentially cause of driving autoimmunity. Is that why people are sick? Is it just heart disease? Is it lung disease? Is it cancer? There's so many things that could be going on that are contributing to this kind of pattern. Is it long COVID? Long COVID is a beast, a huge problem. Most people don't even know they're affected by it. They have no idea. Then you have a cohort who do know, and oftentimes there's inflammation of pre-existing problems. But there are a lot of people who don't even know long COVID is a thing. Who are these people? Why are they getting sick? That's the question. This is going to parallel exactly with excess deaths. And guess what? If you leave this and you let it continue to rise, you will have long term illness, which will fuel excess death again. So, what we are likely to see is this. At the moment, excess death doesn't look like this, but if you leave this alone, excess deaths will start to follow this pattern as well. That's my warning to the politicians who are sitting back hoping this is going to go away. The trend with chronic illness is a reflection that the society is getting sicker. If the society is getting sicker, more people are going to die. It's just that they're not going to die in a year. It may be 5 years, maybe 10 years. But the thing about medicine is that when damage is done, it's very difficult to reverse. That's why most of medicine is about identifying things early. You try and find cancer through screening. You don't wait until it's advanced and spread and then say, okay, we've got cancer, let's do something about it. No, that's not how it works. It's usually too late if you haven't done anything about it. So that's the job. Everybody needs to ask the question. Excess death seems to be causing people to go into their shell. Excess sickness hopefully will make people start to think, what is going on? Is it relevant to me? Why in the world are employers not asking the government about this? It has so many implications. So we can only think that this is something psychological. People don't want to acknowledge the potential of this elephant in the room. We have to. No matter which way we take it, it's not going anywhere. And the longer you leave it alone, the harder it will be to say that it wasn't the factor in excess deaths, excess illness that's growing across the Western world. We need answers, and we need them very, very fast. Have a good evening.